I'm Dr. Betsy Grunch, and I'm going to go through how we utilize an Aspen cervical collar, how you put it on, and how you can adjust it. This is for the Aspen Vista collar, which is an adjustable neck collar that's used after surgery and potentially in traumas where someone has a broken neck. Typically you'll have either a nurse or a physical therapist that fits the collar on you, but I'm going to go through some tips and tricks on how to use it once you get home. So the collar has two pieces. This is the back part and this is the front part. And then in addition, each collar comes with an extra set of pads, which I'll go through, that you could potentially change out at home if the pads get dirty that are within the collar. So how you typically fit this on a patient is you take the back part of the collar. Sammy is my model here, and you want to make sure that the writing is facing up. So this is applied to the back of the patient with the writing up, and then this part with the chin piece will go there, and you just kind of nestle that up under their chin, and the Velcro is applied like that. And then once you kind of get it on, you can adjust it to where it needs to be snug fitting. This piece here is an adjustable portion to adjust the chin, so it pulls out and then it'll turn left or right to raise the chin up and down. So how it's fitting on Sammy now is not okay because there's a little gap there. You want to pull it out and then twist it to get that piece to raise up, where it's right up under her chin, where it kind of limits. Try to turn your head side to side where she can't really turn her head side to side. If there's too much room, it will allow the head to move in the collar, which is not what we want. Your neck might go up underneath it, or it'll be uncomfortable as well. You kind of want to get it where it's just right and snugged in there. And that may also change positions as you get up and move around, so you can have a loved one adjust that as needed. You do not want to have the collar fitting where your chin is kind of inside of the collar like that. This is not the way to wear it. It needs to be where your chin is tucked up under it. You want to lower it back down and then tighten it up a little bit to get a better fit. And then additionally, you don't want it too far down where you can turn your head in the collar and then it's not really doing anything. So you want it to be just nestled right up under the neck, supportive, and still limit your range of motion from side to side. Perfect. To take it off, you just unvelcro each part and you can kind of slide it around like that. The pads get dirty. There's 3 different pads, one on the back and then 2 on the side. These are machine washable, and literally they just unvelcro each piece. And then you can wash these, dry these, and there is an extra set. You can also buy them on Amazon for I think $20 or something like that. And then once you take the dirty ones out, you can put a clean set in, and it just Velcros right into the same position. There's little pieces of Velcro there that will allow that to stick back into place. Then this just kind of goes back underneath there. And these do get dirty if you're eating in the collar. If your doctor tells you that you need to leave it on while you're eating, then this might get kind of dirty, or just oil or makeup here. So feel free to take those out and wash them. And the same thing with the back part. The tricky part with the back part is there is Velcro that kind of feeds up under there. So you'll just want to loosen. You have to pull this part out like this, but then that Velcro will come off and you can trade that out. I hope this helps. And if you have any questions or concerns about the fitting, please reach out to your doctor to make sure that you're wearing it appropriately.